I am Dr. Eli Camp. Welcome. This is my podcast, Vital Wisdom. And this is where I talk about health, wellness, homesteading, raising children, and lots of other topics, all from the perspective of vitalism. I believe I've seen and taught others how the body can heal itself if it's given what it needs, it's not poisoned, and the innate healing ability of the body has been supported, not suppressed. It is my intention to bring what I have learned in my life, especially the last 24 years of being a physician, to help you be your own best doctor. Hope you enjoy the episodes, and thanks for being here. Hi, everybody, and welcome to Vital Wisdom with me, Dr. Eli Camp, and a special guest today, Dr. Samm Pryce. As you know, I'm always talking about the body having this ability to self-heal itself. And the way we supercharge that innate built-in healing is to give the body what it needs and get out what it doesn't need, and tweak and fix things so that we can reach our optimal individual level of health. And today we're going to talk about cancer. And I'm going to let Dr. Samm Pryce introduce herself, and we're going to just jump right into it. And thank you so much for being here.
Thank you.
My friend.
Dr. Eli and I have been friends for over 20 years. I went to medical school together, so I'm so honored to be here. I'm a wife, a mom, a Rotarian, a Paul Harris, and that's me.
In Michigan, doing
In
telehealth.
Michigan. Yes, telehealth. So I only do telehealth, so I can see everybody anytime, and concierge at that.
And you've been practicing medicine ever since you graduated.
Yep, 20 years.
I believe it's been that long.
I know.
I
Crazy.
sometimes think, wow, where did all that time go?
I know.
It's really longer than that because, we started practicing, unlike some medical professionals,
Right.
we start practicing right as soon as we go into medical school. We have clinic shifts.
Yeah.
It used to be they delayed them for a couple of years, but now they start right away. And it's a good thing, right?
I think so. I do.
Yeah, the more patients you
I
can
do.
see before you have to go do it on your own.
Absolutely.
Without someone holding your hand. So cancer, it's, I don't know what you're seeing, but I'm seeing an explosion of cancer, more so than I've ever seen before. Like every other person that I meet and talk to is talking about having some kind of diagnosis of skin cancer, breast cancer, prostate cancer, stomach cancer, pancreatic cancer is on the rise, liver cancer. Like what do you think first before we talk about all this wonderful, approaches out there to cancer? What is going on?
So I really feel like our society is just not the same. And I mean that as a broad term. I'm not talking about just the food. I'm talking about our air. I'm talking about the way people talk to each other. I'm talking about the things we see and the things that we hear, right? So in medical school, we learn about doing cleanses and detoxes and things like that. And I'm like, I've done those, and I've done those with patients, and it's like, okay, that's cool. But in the 20 years, I think I'm now at this level where that's not really cool. I don't think the cleanses and the detoxes are really cool anymore. What I think is cool is if we can get to a level of daily detoxing. And what I mean by that is being very mindful of what we put in our body, on our body, surround ourselves with, right? So cell phone towers, 5G,
Crazy.
skin products, makeup, lotions, shampoos, conditioners, the food we eat, the air we breathe, the toxic, not just news, movies, TV shows, all of that, family members, drama, like even the schools, like the kids now are toxic. And so when I'm talking about daily detoxing, all of this is to be able to control the things that you can control, because the little stuff that goes in that you can't control, right? So the stuff that you accidentally see on TV are the people that you have to be around in the office cubicle that are just toxic with what they say and they do. Or maybe you ate something and it's not organic, God forbid, right? Those are the things that you can't control, right? But the things that you
Air.
can control, the less burden that our body has to process the toxins, the easier the time is. So the way that I think about cancer is everybody has the potential to have cancer. It starts as a regular cell. What happens is something goes awry and it becomes a little toddler, and the toddler, is trying to climb up the little sofa and somebody doesn't see it and it falls down, right? Or then it becomes a teenager and it's like, oh, let's slip out the house at night and take the car and nobody sees it, which is the immune system, right? And then it gets friends and it's like, hey, come with me. Let's go steal this. Let's go rob this store. It's a rogue, it's a rogue cell
Mm-hmm.
that your immune system just didn't catch. Well, why didn't your immune system catch it? Because it was busy detoxing and doing the other stuff that you have put in it or the environment has put in it. It's so busy that it's missing that little one cell that then becomes a bigger cell, which then becomes a tumor.
Mm-hmm. Mm-hmm. That's a really great explanation.
Thank you.
Yes. And you have a very interesting and unique approach.
I do.
Yes.
Yeah.
Tell us.
I started out as chemo is bad, radiation is bad, all of it is bad, right? We should only do the natural stuff. And in working with patients and seeing some of the really bad, right? I've seen where conventional medicine can do good things, right? But it can't be just conventional. You need the naturopathic part of it as well, which is where we call it integrative, is marrying the two. Now, I have seen where we're at stage 0 or stage 1, and naturopathic oncology is a fantastic if we can get it there, right? But there comes a point where we might have to do a little bit more, right? That's integrative, where we combine the conventional. My approach is called the V.I.T.A.L approach. I love this terminology because when you think about going to your conventional doctor and going into the actual clinic, you get vitals done. These are important. So you're getting your height, your weight, your blood pressure. It should happen automatically. You get it every single time. I do telemedicine. So my vitals are different. I'm taking different vitals. They're more naturopathic. I think they are, so the acronym is V.I.T.A.L. V is for valuable sleep. Sleep is probably my number one thing right now. I did my TEDx talk in 2023 in Johannesburg, South Africa on sleep because I thought it was that important. Sleep affects your blood pressure. It affects your hormones, testosterone, insulin, leptin, ghrelin. It affects your concentration, beta amyloid plaques, just everything, right? When I did a deep dive into sleep, sleep also affects your natural killer cells. So natural killer cells are what your body produces in order, that's that immune system part that's going to find the cancer cells and gobble them up. So the World Health Organization classifies third shift work as a probable carcinogen. What does that mean? Those nurses, doctors, all of you guys who are working that graveyard shift, that's the third shift, where your circadian rhythms are off. You're working while it's dark outside and you sleep while it's while it's light outside. The World Health Organization considers that just like smoking, as you might get cancer from that. That's how important sleep hygiene circadian rhythms are, because it affects so many of our hormones. Our master hormone of the immune system, melatonin, is produced when you're winding down and you're about to go to sleep. Super duper important. Chinese medicine has a wonderful sleep wheel. If you ever get a chance to Google it, like if you're waking up between the hours of 3 and 5, it's the lung. If you're waking between 5 and whatever, it's the liver. And oftentimes I use this with patients and I'm like, okay, if it's consistent at a certain time, then we need to work on your lungs. We need to work on your livers. And Chinese medicine does a really good job with emotional components
Mm-hmm.
of
They
your
do.
organ systems. So it could be anger and frustration, or it could be grief, right?
Mm-hmm.
And so we work on both the physical and the mental part of the sleep. So sleep hygiene is just really important. I think that devices like blue light and stuff like that, we're constantly bombarded with it. It makes us alert. We're not sleeping when we're supposed to. Between the hours of 10 p.m. and 2 a.m. is optimal to get that really, those 4 hours are really, really crucial for sleeping. I think that's it for the V, for vital sleep, or valuable sleep, in my opinion.
And did you know, throw something in about sleep? I was reading some early literature from the uh, colonies. So there were a few doctors there, and they documented something that they called the second sleep.
Mm,
And if you haven't ever read anything about this, it's a cool afternoon with a cup of tea, right? How people used to have to stoke the fire in the middle of the night. And
mm-hmm,
so they would go to sleep when it was dark because there was no electricity, right? Go to
mm-hmm.
sleep when it was dark, um, deeply sleep till about 2 to 2:30. Then they would get up and stoke the fire so that in the morning their dwellings were still warm, and they called it the second sleep. And they were doing this study about when are most children conceived. That was why they were doing the study. And they predicted that it was during the second sleep because
Ah.
it took people a little bit of time to get back to sleep. But it's an interesting read, and it was interesting research. And, it kind of died out when I think we started to get electricity and heat and things like
I
that.
agree.
Yeah. So
I
10 to
agree.
2. Okay. So that's
Yeah.
the B for
Yeah,
vital.
that's the V on Vital. The I in Vital is for individualized diet. So if you guys haven't watched it already, go back and see the episode on the blood type diet. So individualized diet is really important. Like, you have to eat, right? So why not eat a diet that is anti-inflammatory and genetic based specifically for you? Food is your medicine. I don't think I really need to go into that. Just go back and watch the other episode,
Yeah. Yeah. Yeah.
which is on the blood type diet. You can get as fancy as you want to. You can do intermittent fasting on top of the blood type diet. You can do veganism, vegetarianism if you're A. You can do pescatarian if you're pretty much any of them. You can do keto if you're O. Whatever you want to build on top of it, but the baseline is blood type diet. And then you can get all the other fancies if you want to, right? The T in Vital is for thorough hydration. I am thoroughly convinced that our society is dehydrated.
It's a state of chronic dehydration. I agree with you.
Thoroughly convinced.
Yes.
I think that if you really think about it, like fatigue, joint pain issues, focus issues, headaches, all of that can be dehydration.
Oh,
You
yeah.
just don't drink enough water. And my patients are like, "Oh, but I'm going to go to the bathroom all the time." Yes, I realize that, but I'm not just talking about the water. I'm talking about the electrolytes, the potassium, the magnesium, all the things, the electrolytes. So if you watch somebody running like a marathon and they cross the finish line and they collapse, they're taking them to the tent and they're putting an IV. There's not just water in that IV. There are electrolytes in the IV, right? You get a muscle ache or cramp or something like that, they're giving you electrolytes. So what if your arthritis is not arthritis and it's just dehydration? What if your blood pressure issues are magnesium, which is an electrolyte, what if your fatigue is just that you're dehydrated and you don't need all that thyroid? I could go on and on about the hydration, right? So I love hair tissue mineral analysis, but you can get it in your blood work. You can look at it in your blood work. Or how about just drinking half your body weight in ounces per day? So if you weigh 140 pounds, 70 ounces of water, I don't expect for you to get it like on the first day. Just work your way up. They've got all these fancy bottles now that like spark to say, hey, it's time to drink. You can put it on your phone, put an alarm every 15 minutes to just have a drink of water. Yeah.
And you add minerals. You have people add trace minerals to their water.
Yeah, they can add trace minerals to their water. But honestly, Eli, like I'm at the baby steps. Like I love alkalinized water, but what I have found is some of my patients that are drinking the alkalinized water is too alkaline at this point, and so I'll have to push them back to regular filtered water. So there's differences in water too. Right. So you've got your spring water, your distilled water, you know what I mean, your alkalinized water. So for those of you guys who don't know, alkalinized is a pH above 7, right? And it is fantastic if you're having like acid reflux, that kind of stuff. So we could get into a whole thing on, I think that people have low acid at this point and not.
I agree. So well, look at all the acid blocker medications and all that. So what I do is RO, reverse osmosis, or even the countertop zero, like the cheap solution. And I have them put 1 drop of trace minerals in.
Yep.
This is how I do, because those waters have had almost all of the trace minerals stripped out. Yeah,
absolutely. So my patients who can't afford that, I'm like, honestly, as much as I don't want you to drink the tap water,
drink water.
Just drink the water, honestly. The A in the V.I.T.A.L approach is for active mental health. So we are in a crisis. And it's all the way down to our kids, which just makes me.
I know. While you gather your breath, I just did an episode on the mental emotional state of affairs. I feel like it's an emergency. And it comes from parents not knowing how to raise their children because their parents didn't know how to raise them. That's one element. Society, what we allow to be aired on TV and radio, what we allow our children to see, putting devices in their hand at a very young age and not monitoring it. Like they click buttons, they go all over the place.
Yep.
The schools, instead of being a warm, nurturing, safe place to assist us in the raising of our children, have in many places, and I'm not pointing a finger of blame at parents or at anyone. I'm just trying to describe what I see as the state of emergency.
Correct.
There are places where kids go and all kinds of stuff is happening. They're being raised by their peers. Ideas are being introduced. There's bullying. And then on top of that, they're not eating well. They're not vital, like as you're describing in your.
Correct.
So, you're right.
Yeah. So it's a big part of, while I'm not a therapist, I suggest that everybody get a therapist at this point. And if you don't have a therapist, then a close group of friends. So I have an accountability group and we meet, it's a business accountability group, but it's turned into so much more. We meet every single week. And even if I can't go, they're going to check on me, right? So you don't have a therapist, but you need friends. So they have this wonderful documentary on the blue zones, right? And part of that is being in community, right? Yes. Just being in community. I think that having accountability, I don't know if the A should be for accountability, but it really is for active mental health. So,
Accountability is part of that.
absolutely.
Yeah.
I think that the more and more, or the older I get, or the more I practice, the more I see how the state of your mind affects your physical being. And I see it oftentimes in cancer patients. So I have that cancer patient who comes in, I'm fuck cancer. And you know what I mean? I'm going to do this. They come in with like cousins and aunts and uncles and the whole support system. What else can we do? And I'll fix the food and I'll come here and I'll do this. And then I have the one lonely patient who doesn't get out, who comes by themselves, who's like, oh, woe is me. Oh no, I can't ever have sex again because they're chopping my boobs off and I don't want anyone to look at me. It's just their labs look different. Their outcomes are different.
Mm-hmm.
And I can now say this, empirical data shows me that it is different. Your state of mind really affects your physical being completely. So active mental health is part of that V.I.T.A.L approach. So part of that is in society in general. I think it's very stressful. So having those techniques such as deep breathing, meditation, tapping, our emotional freedom techniques. So I have it where my patients actually can book sessions with me and I will do tapping with them. The idea is for them to learn how to do it themselves, but you know, if you need me, fine, I will do the tapping with you. Tapping, our emotional freedom technique, is a way in which to use acupuncture points with neuropsychology. So you're actually saying the words out loud while tapping on certain points. And what it's supposed to do is release in the amygdala your thoughts of how things were, to change the response of how you feel about that, which I found to be successful. I think that alternate nostril breathing, which Peter taught me, by the way, kind of balances the sympathetic and the parasympathetic. So for those of you who don't know, sympathetic is that fight or flight. You know, you're running from the lion. It shuts down your digestive system. So therefore you're not being able to digest your food. Therefore you're constipated, all the things. And then parasympathetic is you're calmed down, right? So balancing those two is really important. This is really important for that blood type A who has that higher amount of cortisol level anyway. So that's the A for active mental health in the V.I.T.A.L approach. And really important for patients that have been diagnosed with cancer. Mm-hmm. And then the L is for lymphatic flow. So lymphatic flow is the fancy way of me saying the daily detox, right? That is my rant. So that we should definitely be doing more things to be mindful of what we eat, what we put on our skin, what we watch, the people that we are around, right? I think that's in the blue zones too.
It is.
Like the Ige guy, like them having hobbies and things like that, and walking and all of that kind of stuff. So lymphatic flow includes exercise as well. So, and I don't like exercise, to me is a bad word. I hate exercising, and I'm a blood type O. I'm a blood type O. So I'm like, can I be a blood type A, please? I could totally rock the blood type A, right?
Right.
It's a bad word. But if I think about it, like, hula hooping or dancing or, you know, swimming or something like that. Like, I don't want to be on the elliptical. I don't want to be on the treadmill.
Or moving hay bales, feeding chickens. You
There
know,
you go.
for those of you out
exercise.
there who are farm homesteaders, all of that counts as exercise. You don't have to then go to the gym.
No.
Yeah.
No. Running up and down the stairs doing laundry is exercise, in my opinion.
Absolutely.
So if you have a toddler and you're a stay-at-home mom, that's exercise. So
absolutely.
But that is the V.I.T.A.L approach. I think the V.I.T.A.L approach focuses on the vital force, which is the body's inherent ability to heal itself. And I love Dr. Jim Sensenek's. Like, we were at NMI, and remember he brought the thing that like is a tube and you punch it and it comes back, right?
The rocking
The
doll
rocking
that
thing.
never falls down.
Correct.
Yeah.
So I use that sometimes to explain to patients that sometimes it gets a crook in it
Yeah.
and it's supposed to bounce back. That's how our body is supposed to be. Like the vital force is supposed to just automatically correct to stay up straight. And you can knock it however you want and it's going to come back straight. But sometimes it gets a kink in it. And this is not how our body's supposed to be. So sometimes we need a little extra to get it upright. And that is if we just do those 5 little things. If you can just daily think about, is my sleep hygiene okay? Am I doing an individualized diet to the best of my ability? Am I thoroughly hydrated? Did I work on my mental health today? Did I do some exercise or something, dry skin brushing, sauna, lymphatic flow, whatever? Did I do something to pump the lymphatics today? Those 5 things I think will help us with our vital force.
I completely agree with you. And those 5 things are whether you have cancer or not, those 5 things are critical to health in general,
In
right?
general.
So let's say we've got someone who comes in and they don't really know what they want to do. They're not necessarily looking for a natural approach. They're not against a natural approach. They're not wanting to do conventional or against conventional. They're in shock, right? Because they've gotten a diagnosis of cancer. And you decide, so you sit down with them and you decide based on what they, well, I just said they don't really want anything in particular, but like, what do you do? Someone
Okay,
said
so
they've got,
so this is we have a conversation. So my first question is, what are your goals? Because believe it or not, it is not necessarily always to beat cancer. It is, I would like to see my granddaughter graduate in 4 months. So that is my goal, right?
whatever
So
happens after that,
then
whatever.
we reevaluate goals, right? So I'm not like, I might have goals for that patient and I can voice them, but guess what? Unless we're meeting the goals of the patient, then nothing matters. Nothing matters. It's their health, is their body, is their life, right?
Yeah.
So first I ask the goals and then I address, okay, how can we get to those goals, right? Oftentimes I think that there's peer pressure when you have that cancer diagnosis and it's like, oh, you got to do this right now, or you're going to die. I look at the scans, I look at the blood work, I look at the tumor markers, I look at, like for breast cancer, there's a Ki-67 score, which tells me whether or not it's more aggressive. The type of cancer matters, the blood type matters, right? And so I have a conversation with them as far as, hey, I've seen this before, or maybe I haven't, but in my opinion, this is what I would do. I was like, but here are your options. And that is the word that most people are like, it's giving people options. Like, you don't have to do anything if you don't want to do anything. And that's fine. That's their prerogative. But here are the options. You can do this, you can do this, you can do this. What I like to do is find the options, lay them out. And then if they like one versus the other, then let's talk about how we proceed with that option. In every single option, the vital approach is there because to me,
That's the
just
core. Right.
that's the core of what everybody should do. And then supplements, because everybody thinks that, naturopathic physicians just, we're the supplement pushers, whereas the conventional medicine are the drug pushers. Supplements are what they are. They're to supplement everything else that you're doing. You didn't see in the vital approach, supplements are not there.
No.
Because they're the foundation. Then you do supplements on top of that if needed, right?
Yeah.
So if needed, oftentimes with a cancer diagnosis, it is needed. But we go from there. So if that means that I need to refer out, oftentimes I'll refer out for homeopathy because I don't do constitutional like you do. Like I'll do acute. I know, like for surgery, I want these 3 things.
Right.
It's listening to the patient. It's saying, oh, you said this, so now we need to think about this. Acupuncture, if they're in pain, acupuncture is fantastic. I used to do it in my practice for patients that had cancer. IV vitamin C, things like that. I test out to Research Genetic Cancer Center, it's in Greece, and V.I.T.A.L Cancer Genetics, which is in London. So these are tests that are not done here in the States, but basically they spin your blood, take out the circulating tumor cell, lack of a better way of putting it, they put it in a petri dish and they test all of the chemos, the immunotherapies, and what we consider the natural cancer fighters, right? And then they will tell me within specificity, this is going to work on your specific cancer. It's expensive. Not all my patients do it, but I've had several to do it. It makes it a lot easier and more customized, right? So we know that cells overturn, or they turn over after a certain amount of time. So I've had patients who have done it 1 year and then we come back and do it another year and things have changed. I've had patients where they do it and the conventional standard of care regimen was not there for them, but another one was. And we have tried very hard to get conventional medicine to say, hey, look, this says that this one's going to work, but the one that you're recommending is not working. I found a couple of practitioners where they will go off label.
That's cool.
Yeah. And where we will do lower dosage chemo as opposed to the high dose chemo. So high dose chemo sometimes has really vigorous side effects where you can't even get through the chemo. Whereas if you just lower the dosage and you extend the amount of time, then somebody can actually get through it. My part in that is supporting the vital force, helping to decrease the side effects, helping to make the treatment more efficacious. So for example, like green tea in the morning, it stops the start codon of a cancer cell and it helps with insulin potentiation. It also gives you that pick-me-up because it's got caffeine in it, right? For people who don't want to lose their hair, oftentimes your oncologist is not telling you about cold capping. This is a cold cap that you put on your head. You have to do it the very first treatment, right? It normally can save like maybe 40 to 60% of your hair. Some may shed, but you're saving part of your hair. And to some people, that means the difference between them doing chemo and not doing chemo.
Yes.
Honestly,
Yes.
right? That's huge.
Yes.
That is huge. Peripheral neuropathy, right? I'm not really sure why the oncologists are not telling people this, but you can use, and they have them on Amazon now, cold gloves and cold socks, and you just keep them on, and it prevents the peripheral neuropathy. So peripheral neuropathy is tingling or numbness in the fingers and the toes that often comes as a side effect of some of the chemotherapies. Mouth sores. Zinc sometimes just helps that tremendously, because you also lose your smell and your taste sometimes with chemo. So zinc, we learned that in COVID as well, right?
Right.
So zinc helps with that. So it's all these little things that kind of add up to make the experience not what you've heard.
Right.
Not what you've heard. So I have this whole little thing with what to take to the chemo chair, right? Take your own blanket, take your own snacks, take your own tea and your water, take some headphones, bring somebody with you at all times, right? So my mom has liver cancer. So when I go to the chemo chair with her, we bring a diffuser with lemongrass. She has these fancy little socks that I put on her. We lean her back. I put this really beautiful blanket on her. She normally goes to sleep. I'm like, Mom, you're missing the experience because the diffuser I have has like these lights and like I make it a whole experience, right? But just making it not so gloom and doom. So, yeah.
Now, I am assuming that you have the whole spectrum of people who come in where they want to do conventional and have you support them, or they want to do some conventional and some approaches. And then I'm sure you have people come in and say, I don't want to do anything conventional. And you can help all these folks.
Yes.
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 And
Yes.
I know this is a burning question for people because I get it all the time, but have you seen good clinical results without the conventional if the stage of cancer was not too severe?
Yes. So for those people, I absolutely usually insist on mistletoe therapy. So
Mhm.
I am certified in mistletoe therapy. And the white paper from John Hopkins, thank God, just came out. It came out last year in January, 2024 in January. So now oncologists, your conventional oncologists are usually on board, like City of Hope, which is a big cancer institution. They're in Atlanta, they're in Phoenix, Chicago, and California. They refer to me for mistletoe therapy. So mistletoe is the plant mistletoe that you have at Christmas. It comes in a glass ampule. It's an injection, a sub-Q injection that you do. The law of doctrines are nature. So you see a walnut that looks like a brain, right? And so mistletoe plant looks like a cancer cell. Like it blooms in the winter. Right?
Right.
That's just odd. And then
Right.
when you look at it, it's this like little ball that's like not in on the tree. It's just a ball. It's just
Yeah.
there. It's a tumor. And it
Yeah.
looks exactly like a cancer cell. So you actually draw it up in a syringe, you inject it, and it is very individualized. So I normally do a series. Actually have one. Hold on.
Is this for a particular kind of cancer
No.
or
So
no?
the only one that I don't think you can do it with brain. But I've done it with all the other cancers, every single one that you can possibly think of. So these are the vials,
Hmm.
and then you draw them up. And what it is it's cytotoxic. It basically is going to go in, it's going to find the cancer cell, cause apoptosis or killing of the cancer cell, and it does not harm the cells around. Three side effects, if you want to call them side effects. One is it increases appetite usually. Not a bad thing.
Well, for some people, especially
Right.
those who have lost weight because of the cancer.
Correct. So, um, but sometimes this is a good thing because oftentimes the chemotherapy is making you so sick that you're losing weight, which becomes cachexic, which is muscle wasting, and we don't want that sarcopenia. So, increased appetite helps with pain modulation. So just like weed or CBD works on the endocannabinoid system, mistletoe works on the endocannabinoid system, which is awesome. And then it helps with mood regulation.
Hmm,
Like it
interesting.
actually, like there's this like cloud normally, it kind of moves the cloud. So the only thing that I have seen patients tell me no to is if they're deathly afraid of needles. I haven't been able to get them to do mistletoe, and they think that the tincture is the same. It's not the same. There is IV mistletoe. I don't do IV mistletoe. You do need that has some cytotoxic things that you need to worry about, and plus I'm doing telemedicine, so I'm not doing the IV, and I never did. So I
Right.
think the
Right.
sub-Q works really well. You start off with a series box, which is graduated, and then you find the patient's actual dosage that they need. And the way you do that is they react. A reaction is good. So a reaction is a hive, and it needs to be a quarter size or smaller. If it's over a quarter size, that means we need to lower the dosage. If it's a quarter size or lower, then that's the dosage. We wait until that reaction subsides completely, and then we re-inject around the area in a different place with the same dosage.
I was just going to ask you. So you said injection. So you're injecting. Well, what if it's pancreatic cancer? You just do it over the pancreas area,
No, so you do it around the abdomen area,
just in the abdomen area.
around the belly
Interesting.
button. Hmm.
Interesting. Well, I'd love to read that white paper for sure.
Yep.
Um, so, so mistletoe therapy, um,
Saunas for
sauna. Yep.
detox, dry skin brushing, alternating hot and cold. All my patients are told, when you're taking a shower, just alternate your hot and cold, or bare minimum end in cold.
And
Uh,
if you have a constitutional
that would
hydrotherapy
be amazing.
potential near them, have them do that. Yep.
That would be amazing if they could get that done.
Now,
Um,
What about people who come in and it's not as low risk or low grade, and but they're not super high risk or high grade? What about those folks? Do you actually recommend to them to think about doing a mix of natural and conventional?
Mhm. So the team that I work with, the oncologists that I work with, are very good at, now that we have this relationship. They understand how I feel about things, and I can go to them and say, I want low dose chemo for this patient, and they will listen. So it's building the relationship, having the relationship with I often tell my patients that concierge is not just me, it is us building your team. There's a
Right.
team approach to this, because I've had other oncologists where they're like, I'm not going to treat you if you're seeing her.
Oh,
I was
man.
like, we need a different oncologist then, because they don't play well in the sandbox.
Yes, yes.
You should want everybody to have eyes on you and multiple different opinions. Like I said, options are great. And
Yeah.
then you can decide which one is best for you. So, depending upon what the labs say, the constitution of the person, what's going on in their life. So, for example, like I have seen multiple times, and I hate the fact that I've seen it, but there's like this storm: divorce, job change, move, or kids going off to college, now they're empty nesters, an affair, or something else. It's three things. It's usually
Right.
a storm of three, and it's breast cancer. And it
Yeah.
usually happens within 2 years of the storm of whatever happened. So, depending upon what's going on in their life, so I do get personal, like what's going on in your life. So, depending upon what's going on in their life, how well their vital force is. So, we're checking the vitals, right? If their sleep is off, probably going to recommend some additional therapies. What else? Ki-67 score if they have breast cancer, the tumor markers and what they are. If they're above the standard reference range, then I'm probably going to ask for some integrative therapy. Normally, what I'll do is if I'm on the ropes about something, I will say, let's give it 3 months.
Mhm.
So, effort equals results. I always say that. Let's see how well you do.
Yeah.
And then we will retest. We'll look at the cancer tumor markers. We'll look at all the labs. We'll check the vitals, right? Which we're checking more than just every 3 months, because we're
Right.
talking constantly. And if I think that they're that patient, I'm happy to
Yeah.
aggressively do naturopathic oncology with them.
Yeah. Yeah.
So
How's your mom?
she's doing really good,
I'm
really
so
good.
glad. I was worried
Treatments are
for her.
working, tumors are shrinking, like they're all dead except for one. Like she has multiple spots. And so those are all gone. There's this one that's like in this really precarious area that they cannot operate on. It is slowly shrinking. My new thing is to look at, it's called histotripsy, sound therapy,
Yep. Yep.
which,
I've read about that.
yeah, they developed it at the University of Michigan right here.
Oh,
And
wow. That's cool.
we go up to Chicago for normally her treatments, and University of Chicago did the first liver one. So I'm looking at them possibly. She did TACE, which is where they dip beads in chemotherapy and radiation. That was the first one she did, but had a severe reaction to the pain medications that she gave her and ended up with hepatic encephalopathy,
Ugh.
because the liver doesn't process those pain meds. So we
Oh,
found out she's allergic to that. But yeah, so, and thank you for all of your help. So,
my pleasure.
God,
Is she still
yeah,
using the homeopathic?
no,
No.
because she doesn't need that right now. But
That's
like
very
when I
good.
say, like, I was so excited that my stepbrother was there. We got the homeopathic and brought it upstairs. She took it, and you could see the immediate change. It was like, and I love that. Like, I don't get to see it very often because I don't do homeopathy like you, but I was like, oh yeah, that was the homeopathy.
That's what
That
keeps
was
me
it.
going. Are those
I love
patients where
it.
you can live time right
Yeah.
in front of you see something changed and
Yes.
you see a physical expression of that for sure.
Yeah.
I have to tell you, one of my most favorite things you said today was you go over options with people. So my experience in talking to folks who come to me from the conventional system is that they got some kind of diagnosis. It doesn't even have to be a cancer diagnosis. They are told what they need to do. And if they even start to ask questions, they're kind of bullied into, well, if you're not going to do it this way, you have to find another practitioner. And it doesn't have to be that way, right?
It doesn't.
It doesn't. Options of what is possible, what is efficacious, and what fits with people's belief system and lifestyle, what they're capable of. I mean, some people don't have a support system at all.
Exactly.
At all. And some
Exactly.
people have so much support that you kind of like want to divide them up into groups and say, okay,
Yes.
you help in January, you help in February. And it varies from person to person. Wow, what a great talk. So this is kind of a peek, folks, into what an integrative approach towards managing the health of the body when you've been, you have a diagnosis of cancer from having a vitalistic doctor on the team. Because
Mhm.
there's other types of doctors out there who say, well, I do integrative care, but it's different than what a vitalistic naturopathic physician
Correct.
offers and brings to the table. Um, Anything that you think is really important to tell folks before we wrap up? I could talk about this with you for hours, but
Me too.
I know
So,
you have patients to see and I have chickens to wrangle.
I'm coming to see you.
You need to.
I am.
I was going to buy you a ticket that one time. Then I thought, no, don't buy the ticket. She's probably off to some conference or off to South Africa or like you're
No,
always like,
that's going to be
oh,
my vacation. My vacation is going to come see you.
okay,
Yeah.
that's the deal. I'm going to put you to work though.
Yeah, that's fine.
Okay.
That's fine.
But
For my 50th birthday, like every single month, I'm going to do something with different pockets of people, and I'm coming to see you
okay,
for
I
sure.
think you should. Yes.
It'll be
So
fun.
what do we want to tell people out there who may have who knows where they're at? What do we want to tell them?
Take a breath. You don't have to do something today, right? Find somebody that's going to listen, that's going to give you options, and you always need a second opinion. So a second opinion is not in the same healthcare system. You can't go to a different doctor in the same hospital. It needs to be a different system. So you always need a second opinion, and sometimes you need a third to give you options, basically. That's it.
Well, wonderful words of wisdom, the vital approach. Dr. Samm Pryce, everybody, thank you for being here, my friend, my colleague.
Thank you.
Y'all have a great week, and I'll see you next Sunday. Thanks for joining me today. For those of you who have written and emailed and are interested in my books and other offerings, I wrote The Unvaccinated Child as a resource guide for parents and caregivers to navigate childhood illnesses in a natural and healthy way. And while the intended group was the unvaccinated, it turns out it's an important resource for the vaccinated kids as well, since vaccines do not necessarily prevent illness. Smoke Rings is another book I wrote, and that's to help smokers support their health, regardless if they plan to quit or not. So, for people who smoke, love a smoker, used to smoke, continue to smoke, this book helps you be your healthiest version. And when I say it is judgment free, it is absolutely judgment free. You're free to make the choices you make. I'd just like you to find better health while you make those choices. My most recent book, Homeopathy, A Foundational Approach, is really great for someone, whether they're a complete beginner or they've already been practicing homeopathy. It starts at the beginning and it guides the readers through the basics and on into first aid and acute practice so you can start using homeopathy right away. That's the most important thing to me, is to get folks using homeopathy in their everyday life. My workshops and courses can be found at either ecampnd.com or longshadowsranch.net. Have a great week. Again, thanks for joining me and thanks for your support.